Can you guys hear me okay?
Yeah, we can hear you loud and clear. Thanks, Lori.
Okay. Hi, Chad.
I was wanting moonlight dinner tonight.
I can't believe they don't deliver to your house.
We Webster County don't have DoorDash, so
That'd be a little bit of a dash, wouldn't it?
yeah, that's right.
Hello, everyone. I am glad that so many of you have already joined. We're right at 6:30, and I intend to kind of keep us on track tonight, but also just need a couple of minutes to make sure that we got everybody's attendance noted. So going through the participant list. Ask people to identify themselves. It's like Samsung. We have one participant that's logged in as Samsung SMA156. Could you speak up just so that we know who you are?
It's probably me, but I can't tell. Alan,
Okay, I think that is you. Welcome, Alan.
I had to get on my phone because my iPad doesn't want to work. So
Yeah, IT can be frustrating, but thank you for joining.
Hey, you seeing me all right? Charlie Castle.
Hi, Judge. Thanks for coming. And we will get started just in a second. I see John Marshall has joined, but just going to make sure that we don't miss anybody in the participant list, and we've got a full attendance.
Clay, I'm here. Mine says Amy's S25 Ultra or something. I don't know.
Thank you, Dr.
Okay.
Ratley.
Okay.
I could identify that one, so we've got you
Okay,
down.
good, good. All right. Good deal.
All right, so I think I have accounted for everyone. We have 12 members that have signed in so far, which gives us a quorum. And I'm expecting a few more. Oh, there's 13. So we'll keep an eye on it, and I have Travis kind of helping me take attendance. So we'll make sure that we capture everybody. But I think in the interest of time, John, if you are ready, we can go ahead and get started. Just before I turn it over to you to call the meeting to order, though, I just thought I'd first of all just say thank you to everybody for joining tonight and for your flexibility and in the format change from going from a hybrid in-person meeting to all video conference. I think the roads, at least the ones that I've been on, were a lot better today than they were yesterday when we made this decision. But given the condition of a lot of the more minor roads, the temperature, and the after dark travel, I still think this was probably the right call for everybody's safety and time tonight. Just a couple of things, kind of, I guess, logistical things to discuss with the all virtual meeting. We've done these before, but it's been several years. We are live, or we are streaming this to YouTube Live to make us compliant with the open meetings laws. So just be aware of that. We are recording the meeting for our internal note-taking purposes. Wanted to make you aware of that as well. In order to comply with the open meetings law, so if anyone's participating in the meeting, speaking up, asking questions, you are supposed to be able to see and hear all participating members. So please keep in that in mind, and if possible, if you can turn your camera on for those moments to talk, so that everybody can see who's talking and be aware of that. And then obviously we always are aware of the risk that we have with IT systems when we hold meetings like this. So if you happen to get disconnected, please just try to rejoin. If you need help or assistance, shoot me a text, or we have IT support on the call to kind of help look for some of those issues and assist people if they need to. And if I get disconnected for some reason, please just stay where you are. Let me reconnect, and then and make sure that we can restore the stream to YouTube. I don't anticipate that happening. We typically have a pretty good stable internet here at the health department, but I don't want to. I probably hope I didn't jinx us just by saying that. But if I do get disconnected, just please be patient, and I'll come back. And if for some reason I can't work it out, we have enough staff from other locations on the call that I can get word to you, and we can figure out what to do next. Without that, with those being I guess the logistical things I wanted to mention, John, if you are ready, we have a quorum, and you're free to call the meeting to order.
Okay, can you hear me okay, Clay?
Yes, sir. I can hear you fine.
All right, I'd like to call the meeting to order. Thank everybody for Zooming with us tonight. It's been a while since I've done this, so I was really worried whether or not I was going to get this done, but we do have the quorum. If y'all can review the minutes from last meeting, and I need a motion and a second.
I move to approve the minutes as presented.
Okay, a second.
I'll second that. Chad Townsend.
Okay, good. Any discussion? If not, all in favor, aye.
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 All right, all right.
Aye.
I'm a loser.
All right, anybody that wants to vote against? Okay. Move on to the financial audit. Lori, are you there?
I am.
Hey, there you are.
Yes. Good to see some of you. Others of you to see your blank tile with your name. Um, I'm going to update you on our financial audit. It is in process. But to kind of update you on what's been going on, there's attachment 3 in your packet that Clay emailed you earlier today. And offer a little bit of context and explanation. It's a letter from the Department of Public Health addressing some of the challenges that have been associated with Workday and that transition into the new accounting software and the challenges that we faced. So over the past 18 months, we've been communicating that with you guys every time we meet. Just as a recap, Workday is an accrual-based accounting system. It was required to be changed over and modified to a cash basis accounting, and a lot of that modification presented some reporting errors and really created a lot of challenges in the programming. So some of the things that delayed our closing of fiscal year 25 was, errors on the income statement, the trial balance, the balance sheet, and then the bank reconciliation. Corrections were made to the income statement and bank reconciliation reports. Those were completed late fall, and that enabled us to feel confident enough to move forward with submitting our close in late October. It took Department of Public Health until early January to approve our closeout. As a result, we missed some deadlines, and keep in mind, as the letter from DPH states, every health department across the state has met these deadlines, missed these deadlines. The reporting requirements for the Department of Local Government, as far as submitting our end of year financials, the submission of the audit, completion of the audit is typically already past due. So as a result, DPH on the behalf of all the health departments requested an extension with the Department of Local Government, and that was granted for all the reporting. And in addition to that, they extended the audit requirement as well. Our audit, Kemper CPA Group has been working on that. We are anticipating it being completed within the next 2 weeks, maybe a little sooner. But some things that the letter references and to make you guys aware of is, I believe last time we met, I let you know about the balance sheet and the errors with that, and the importance of having an accurate balance sheet and trial balance for your audits. And that can result in identifying material weaknesses from an auditor perspective, and it may be noted in our audit. We do know at least a couple of health departments have had that happen already. So DPH issued this letter basically for the board to kind of reiterate to you guys and that all the delays and the errors and any of the resulting material weaknesses that may be identified and commented on in the audit are a direct result of DPH's basic inability and challenges with their delay, with the programming delays, and their inability to get the closeout completed in a timely manner. In working with Joy and talking with her, I don't foresee us having any material weaknesses identified. Due to the fact that I manually tracked all of our liability account transactions throughout the year and is able to produce, a timeline to the auditors with that respect, and our ending balances, and document our opening from the closing of FY24 through the opening of FY25, all the way through the closing of FY25. She believes that's a good mechanism and an acceptable mechanism to offset having an actual report detailed within Workday. We were just tracking it outside of the system, so it's still going to suffice and meet the needs of our audit. So by the time we meet at the next board meeting, we will have the completed audit. We will, Joy will join and present that to you guys. But I just wanted to update you with where we are on that audit. Does anybody have any questions? Okay. Clay, do you have anything you want to add to that at this point, or do you want us to go ahead and continue on to the financial statement?
I think you did a great job of summarizing that, and I don't have anything to add other than just to highlight to the board that I'm appreciative of you and your hard work. I know that this has been an extremely challenging close, and while we haven't had the final audit results yet, so we don't want to speak to those, but we have gotten positive feedback from the folks conducting that audit, and I'm just feel very glad, very fortunate that Lori did such a good job with the documentation and keeping good records when we had the software system wasn't always reliable.
Thanks, Clay. I appreciate that. John, we don't need to vote on that since we're not actually presenting an audit. So we can, if everybody's ready, we can go to the financial statement.
I just had a quick question. Bill Starks.
Yes.
Are we making progress on working out all these intricacies with the Workday program? Does it look like we're making progress there?
Yeah, progress is being made. They have not, couple of the challenges still remain. There's still a few adjustments to be made to the balance sheet, mainly involving a couple liability counts for us, and then the reserves, how they're accounted for on that balance sheet. Our reserves, I give you guys a summary, but reserves are usually tracked and earmarked specific to program funding, and those funds are restricted to those individual programs. The way it's currently set up in Workday, it's just a lump sum, state, federal, and local, and not within each program. So there's some little nuances that need to be finalized to show that and make it a clear record. As far as opening balances, we're still waiting for FY24 ending balances to be loaded in as FY25. So it's still a manual transition between the opening balances, the current year, FY25 current year, and then the ending balances. Once all that's completed, we're hoping they'll be able to upload FY26 opening balances. So there are a few things still of concern, but we are making progress.
I'll also note that while the system's not perfect at this point, I do think a lot of the reporting processes have been put in place and a lot of those corrections have been made to the system. We still find bugs here and there, but in large part, I think it's set up and designed the way it needs to be now. There's a lot of bottlenecks in state government, and I think a lot of the continued delays we're seeing are more a result of processing time with Kentucky Department for Public Health more than they are with issues with the software. Not that there aren't still issues with the software, but even there, getting those troubleshot and resolved timely has been challenging. I will say this, that that we also made progress in that our close has been approved from the Kentucky Department for Public Health, and that was we were pretty vigilant in terms of staying in contact with them and following up. I mean, I can't think of a better word, but we pestered them a lot to make sure that we were getting the attention that we need. There is a new division director within Department for Public Health that's over the accounting and financial management systems. Her name is Kim Beers, and I meet with her regularly. And typically, I want to say 90% of what we talk about is Workday and the processes and the bottlenecks with DPH, and we are seeing some improvement, but we've still got a long way to go.
Any other questions? Okay. John, you're okay with me moving forward?
Yeah, absolutely.
So the attachment number 4 is the financial statement that was in your packet. This financial statement runs the period July 1st, 2025 through December 31st, 2025. So we're halfway through the fiscal year on this report. The first side, again, is expenses. As a reminder, the blue column is the home health, adult daycare, EPSDT special services programs. And then the green is the clinical and direct program services. Line 53, the salary and fringe benefits. Through the end of December, the district has expended $7,749,784. So we're about 44% through our budget. Home health, EPSDT, and adult daycare has spent $1,134,385, which is 54% of the budgeted amount. Total expenditures to date for the district are $9,024,853, which is 48% of our budget. And home health, EPSDT, adult daycare is $3,354,482, which is 49%. Expense-wise, we're right on target for the year, progressing very well. If you flip to the other side, as far as the revenue, line 19, state revenue. In state allocations, we've received $3,057,380, which is on target at 51%. Federal, we've received $1,698,021, which is about 71%. Medicaid dollars, the districts received $703,016, which is 43%. Home health, adult daycare, EPSDTs received $3,020,595, which is 54%. Overall, the total receipts for the district is $10,457,990, which is spot on at 50%. Home health, EPSDT, adult daycare is $3,163,009 at 46%. So overall, revenue and expense are on target for the year. The district is projected to end with a closing surplus of about $2.5 million. Home health, EPSDT, adult daycare is projected right at a net $100,000 deficit. However, there have been some billing challenges that may bring that back up in that within that final quarter of the year. Unrestricted reserves, we closed the year at $13,574,444. Home health, EPSDT, adult daycare reserves are $4,560,644. Our retirement fund reserves are $11,147,187. Current cash balance, including all investments, is $31,634,467. If we were to receive no future funding, it would sustain operations for 15.3 months. So very, very healthy position for the year. Does anybody have any questions?
Hey, Lori, it's Lance.
Yeah.
I guess I officially need to start my video. So at this point, with this big of a surplus, is there any discussion about moving more money into our investments and less leaving in cash on hand?
Cash on hand, we keep about 50% on hand. The rest are investments. So when I'm listing current cash balance, I'm including the investments. That's our grand total.
Okay, but there's no thought process about maybe moving more of that into our investments at this point?
Yes, as CDs have come due and rates have improved, or about every 6 month track with the CDs. We've opened several. We do still have our money market account, which gives us some easy liquidation. But yeah, we have periodically talked about moving, how much more to move. So usually after we receive that first half of that semi-annual tax appropriation from the districts, then that puts us in a little better position to be able to move more money.
Okay, yeah, I mean, that's not my area of expertise, but I just want to make sure we're thinking about constantly what we can do with that money as opposed to just having it sit,
Mm-hmm. And the way we have our portfolio set up with Independence Bank, our checking account makes quite a bit of interest as well.
Thank you.
So do we need a motion at this point?
I'll motion to accept.
Okay, in a second.
There's Fleming.
Second.
Is there any more discussion? Lori, did you have anything else you wanted to say?
No, just Lance, if you look at line 17, that for interest earned to date is about $471,912 currently, just to give you a number to reference to.
And I just want to confirm, was that Athena Minor that made the second?
Yes, it is. Sorry.
Thank you, Athena. I heard your voice, but I just wanted to make sure, I didn't look up in time, so I just want to make sure it was you.
Yes. Sir.
Hey, Lori, you said line 17. What was what? I'm sorry.
Line 17 on the revenue side of the financial report is the
Gotcha.
interest received to date. It's
Right.
$461,912.
Okay.
Just to give you a number reference.
So what is the, on that line 17 for clinical services and direct programs budget interest, what is the difference there?
Say that again.
So the clinical services and direct programs budget
Uh-huh.
on line 17,
It's about 40% of what I budgeted.
got you. Okay. Yep. All right. That makes sense. Thank you.
You're welcome.
Okay, if there's not any more discussion, we have a motion and a second. All in favor, aye.
Aye.
Right.
Aye.
Any opposed? Okay, motion is carried. The public health director report, Clay.
Yeah, thank you. Thank you, sir. I have what I hope or what I think is probably a short report for you all tonight. I had just three things that I wanted to bring to your attention and discuss. And one of them is a rehash from the last meeting. But obviously, if anything comes up or if you have any questions about the operations of the department, I'm happy to field those as well. I did want to give the board an update on our issue with the Kentucky Public Pensions Association. The issue that I went into more detail at our last meeting about the amount that they've billed us for our accrual valuation of the liability contribution. We are still kind of working through that dispute with them. For those that may not have been on that meeting, basically in 2021, the legislature restructured that unfunded liability for the state retirement system, and they did an evaluation for every agency that participates in that and determine what that unfunded liability proportion was for that agency. And then they set up a payment plan over 30 years to pay that off. And that was a great benefit to the health department, mainly because the old methodology was to assign a percentage of payroll to every agency. It was the same percentage. It was about 93%. So, we were having to pay basically double salaries anytime that we hired someone. This doesn't really change the overall dollar amount, but it did restructure it as a flat rate so that we would just be able to make those payments off 30 years. And then whether we add or lose staff, that didn't necessarily have a determination on that. So back in 2021, when they set that up, that cost for Green River District Health Department was a total cost of about $81 million. And we were paying about $4.4 million per year. Now, a big portion of that we were able to receive from a subsidy from the state legislature, but needless to say, that was our set payment that we were paying every year. Part of that plan was that they based on their actual experience, every 4 years they would reevaluate that. And so as we hit that 4-year mark, they put out a budgeting document that we created this year's budget on that reduced that amount for Green River District about $721,000. But then when the year started, for lack of a better word, they stated they made a mistake and billed us for the old amount. So we are disputing that, and we think that, and some of the reasons that they're citing for continuing to charge that higher amount are in error. And so we've been working through that process, and what we decided to do, or what the Kentucky Health Department Association decided to do, because this impacted every health department in the state, was to ask for a Attorney General's opinion on this. So that has been submitted. I believe, it's been acknowledged from the Attorney General's office that that's been submitted, but we are still awaiting a decision or an opinion from them as to the correct interpretation of this law. Our legal counsel that is helping us with this process told us from the very beginning that this would be a long process. It would probably be February or March of 2026 before we got any type of response. So we are still within that time frame, and I don't have anything new to report from what we talked about in October, but it is a substantial amount of money for us. Again, about $721,000 for the current fiscal year. We are making those monthly payments, although we have noted with the retirement system that we are doing that in protest, just so that we are avoiding any kind of interest or other penalties that may be associated with not paying that liability. So I will continue to update you all on that process, and we expect to hopefully get a favorable opinion from the Attorney General in the next couple of months, and then we can adjust from there. Before I move on, just want to make sure if there are any board members have any questions about that issue. I think we've done everything we can up to this point. But again, it is a major financial impact. So I wanted to make sure that I was keeping you all aware of that.
Clay, I did want to ask, I think I mentioned this before. My understanding is the Attorney General is not required to give an opinion. When they acknowledge your request, did they say they do plan to issue one?
I do not know that they said that they intend to issue one. And you are correct. I don't think they're required to do it. And also, if they do, it may not necessarily be legally binding. So the retirement system might read it and say, well, that's nice, but we still disagree. So we will cross that bridge. I think it would just help us make a decision if we could get some clarity as to whether our interpretation or their interpretation of that statute are more in line with what the legislature intended. And we have already kind of looked through planning on coping with this if we get an unfavorable opinion, and we think that we're positioned well enough to do that. But again, we want to make sure that it's equitable for the various agencies, and also it's what the legislature intended in 2021 when they passed House Bill 8. Speaking of the legislature, the other thing I wanted to bring the board's attention to is we are in the legislative session, and in terms of the health department's advocacy and our watching this session. The big item that's on our radar is the biennium budget. In your packet, I included I was going to say it's a one-pager. I guess it is a one-pager summary of the Foundational Public Health Services funding request. But on the back side of that was a line item summary for every health department in the state in terms of what we are requesting in state funding for the next biennium budget. Just to kind of summarize the Foundational Public Health Services fact sheet that was in your packet. This is attempting to explain the methodology that the legislature put in place in 2020 when they passed what has, I guess, become known as the Public Health Transformation Statute. But what that legislation did was it established a formula and a methodology on how to provide foundational services for every public health department in the state. And it did that by examining what they call foundational public health services and core public health services. I guess the best way, and those are listed out on that fact sheet, or the type or the categories of those are listed out on that fact sheet. But those are the services that health departments are required to provide by state law. And so, looking at just those minimum mandatory services, looking at the population of each health department jurisdiction, there was a formula that was determined how many full-time employees would be necessary for just those foundational services, and then establishing a funding formula that's in part from local revenues, local property taxes, and then with the balance of that calculated funding requirement coming from state funds. So I guess what we're advocating for, what we're asking from the legislature as they consider this year's or this next biennium's budget, is for them just to follow the plan that they passed in 2020. And so that details out on the backside for of there. And if you look, you can find Green River District. And this includes our foundational funding for those foundational and core services, as well as the pension subsidies that were passed in 2021 with House Bill 8. So our total funding request for state funding for the next 2 years in the budget would be about 4.5 million in fiscal year 27, and a little over 4.6 million in fiscal year 28. That's kind of really in the same area or same neighborhood as what our current funding is, because a portion of the formula relies on 1.8 cents coming from your local tax assessments. That fluctuates from health department to health department across the state based on what local tax assessments are. But that will be our request to the state legislature. That unless it dropped this afternoon, I don't believe the House has released their budget yet. So we are waiting with anticipation to see if that funding is included when it does come out. But just from our experience a couple of years ago, we know that oftentimes that first draft comes out. It may not include everything. It's a starting point with the negotiations, and it really some of these our last 2 years ago when we made this funding request and health departments received the funding that we did request, we didn't get it till the very end of the legislative session when the House and the Senate were in conference committee over the budget. We kind of suspect that sometimes health departments are used as a bargaining chip because there may be various representatives that would like to fund them. So there's a lot of uncertainty usually going through these legislative sessions. But I just wanted to share that handout with you all and let you know that that is what we're requesting and what we're advocating for with the legislature this go around. And then the last thing I wanted to bring your attention is just you may have heard some reporting or seen in the news about Kentucky received a rural health transformation grant from the federal government. And so to give you a little bit of background on what this is and how it may impact health departments, much of that's still evolving in terms of what our involvement could be or will be. But the Rural Health Transformation Program was a $50 billion allocation from Congress as part of the big spending bill that they passed back in the fall or summer. At the one big beautiful bill. But in this allocation, all states were given the opportunity to apply for funding, and Kentucky did quite well. So out of the $50 billion available nationwide, I think every state was invited to apply for 200 million, up to 200 million annually for their state. Kentucky was awarded 213 million in the first funding period, which ranked the state 11th nationally, and was the full request that had been submitted. So I think I don't know if that surprising is too big of a word, but certainly as a state we should be very pleased with that outcome. But that grant proposal was focusing on 5 major focus areas. Obesity and diabetes, looking at prevention for those health factors, maternal and infant health, with especially a focus on counties where maternity care is substandard or what they're deeming maternity care deserts. There's an emphasis on behavioral health and substance use disorder, a focus area on oral health access with a component that deals with teledentistry, and then a focus area on emergency response coordination or with emergency, like your ambulance services, your EMS services. This funding was really kind of intended to bolster health outcomes in rural communities. And you know, they're very much in just the early stages of setting up the programmatic activities that will address these. The first block of funding for Kentucky will be rolled out over 21 months, and they'll have the ability to spend about 213 million. And then each of these outcomes from these focus areas will be reevaluated and have the opportunity for more potential funding down the road over the 5-year cycle for this allocation. So the Kentucky Department for Public Health has stood up a new division level organization and they have a leadership and team in place for that. In terms of specifics, I haven't heard many yet, but I think looking at these 5 focus areas, I think they very much align with the needs and pressing health issues that we've identified in our own communities, and think that there will be opportunities for our health department to participate in this and maybe get a lot of benefit from this federal funding. So again, I wish I had more to share with you in specifics, but the programming is still being built, and just wanted you all to let you know that we are watching that very closely. And we are, going to, hopefully be talking to you more about that down the road and look for areas where Green River District Health Department is able to plug into that. So with tonight being the winter weather and everybody participating by Zoom, those were the 3 items I included in my director's report in order to try to keep this brief. But looks like we're doing well on time, and I'm happy to field any questions you may have on those items or anything else.
Hey, Clay.
Hey, Lance.
Hey, real quick question. With all the rapidly changing issues with vaccination recommendations and measles outbreaks, is there anything currently you're seeing as a particular concern in our district?
Well, we haven't, fortunately, we've not had any measles cases in our district. There have been a few in the state. I think we are highly concerned in terms of trends and I guess attitudes towards vaccinations and immunizations. I would say that, we are still very much believe that this is an important part of public health, that in the course of history and looking in terms of health outcomes, there's probably not been any greater achievement than being able to produce and develop some of these vaccines. But we are continuing to try to share that message. Our immunization programs really have not changed, even though there is probably more skepticism and concern from the public. We are continuing to try to I guess root our messaging in science-based recommendations, and we are continuing to promote immunization and think that it's an important part of keeping our population healthy.
Well, I guess I just say that to say, like, I wonder where that puts district health departments on the line when you have recommendations coming from the federal level that are not based in science, and then you have all the organizations, for example, several that I'm a part of, the Infectious Disease Society of America, the Society of Infectious Disease Pharmacists, the American Association of Family, Physicians, and all these people saying, no, we need to keep the same schedules. I wonder sort of what situation that puts public health departments in, and if there is any sort of help you need from us as board members in those sort of tight scenarios when those questions come up.
Yeah, I think that, I don't know of a specific ask, but I think that it does make communication very challenging. I think that we are trying to take approach that we are continuing to look for good, sound, scientific recommendations, and that is what we're basing our decision making on. We're not trying to so much confront folks or participate in debate, because frankly, it doesn't seem like in many cases that's likely to change people's minds. But we are trying to now, I don't know. I think the pendulum may swing when you see negative outcomes, and so I think we're just going through a change in attitudes, change in perceptions, change in trust, and it's a concerning time for public health. It's something that we spend a lot of time thinking about, but also it's a big nationwide, global wide trend, and I think we just have to try to maintain our perspective, and we have to just kind of keep on trusting the scientific based recommendations and following that program guidance.
Yeah, and what I would ask is that if there's ever a problem where there becomes issues for you guys, as far as are we, getting pushback because we're doing what's right by science, I just want to make sure the board is fully supporting you guys and, giving you any support you need. So let us know if you need it.
Okay, I appreciate that.
So are we at new business?
We are at new business, and unless the board has any to bring forward, I have nothing else to bring tonight.
Does anybody have any new business? Okay, you want to set the next meeting date?
We have our next regular scheduled meeting set for April 21st at 6:30 p.m. And the plan, hopefully in April, we'll have a lot better weather. So that will be here at the district office in Owensboro. But we will, as we typically do, provide a hybrid video conference option for those that may not be able to travel.
It's 4/21 at 6:30. Is that what you said?
Yes, Judge.
Thank you.
Okay, if there's nothing else, then I'll just need a motion and a second to adjourn.
Move to adjourn.
A second?
Second.
I can
All in
second.
favor,
A second, Rosemary Amick.
Second.
all in favor, aye.
Aye.
All right, any opposed? Are we done, Clay?
We are adjourned. I appreciate all of your time tonight. And again, thank you for being flexible and doing this virtually, and wish everybody to stay safe and warm out there.
See you in April, bud,
Thank you.
if not before.
Thank you all.
Thanks.
Thank you.
Thank